for surgery. My name is Laura and I'm a physiotherapist at the Surgical Optimization Clinic. Before we get started today, there's a few things that you will need. Your before, during, and after joint replacement book, your My Responsibilities worksheet, as well as a pencil or pen.
Hi, my name is Amy. I'm also a physiotherapist at the Surgical Optimization Clinic. I want to let you know you can pause or rewind this video at any time to review any presented information. Any resources mentioned throughout the presentation are listed on the back side of your worksheet for your reference. Throughout the presentation, we will be working through your worksheet. Please follow along. You will be required to sign and submit this worksheet prior to your surgery.
Why prehab? Well, we know that people who are prepared for surgery have a smoother, faster recovery. They experience fewer complications, not only post-operatively, but pre-operatively as well. They generally have a better overall hospital experience, as well as less anxiety coping at home after surgery. Today, we're going to spend some time talking about what exactly is osteoarthritis. We'll give a brief overview of joint replacement surgery, as well as talk about some of the things that you can be doing now to prepare for your surgery, including nutrition, weight management, physical activity, smoking cessation, minimizing alcohol consumption, and then we'll spend some time talking about planning ahead, as far as making sure that all of your dental work is up to date and that you have a solid discharge plan in place, as this is still considered an elective surgery.
Osteoarthritis. It is the most common type of arthritis, affecting nearly 5 million Canadians. That's 1 in 6. It typically affects the weight-bearing joints, such as the hips and the knees. It is a progressive disease that leads to a breakdown of cartilage and the underlying bone. Cartilage is the tough elastic material that covers and protects the ends of the bone. It also acts as a shock absorber. Symptoms of osteoarthritis include joint pain, stiffness, aching, reduced range of motion, and swelling. On this image, you will see a normal knee and an osteoarthritic knee. On the normal knee, you can see articular cartilage, the meniscus, and the normal joint space with the bone. On the osteoarthritic knee, you will see bone spurs, cartilage loss, and that joint space narrowing. This is an image of a hip x-ray. I'm sure many of you have seen a copy of your x-ray. This first x-ray shows a normal hip with the femur and the pelvic bone. Cartilage is on the ends of the bone, and it is smooth material that allows the bones to move easily over one another. Cartilage, however, does not show up on x-ray. Therefore, the joint space in a normal joint is actually visible because the cartilage is in place. With an osteoarthritic hip, the cartilage wears away and the bones rub together. You can see the reduced joint space on the second x-ray. This is an x-ray of a knee. Similar to the hip x-ray, the cartilage is on the ends of the bone and the smooth material that allows the bones move easily over one another. Cartilage, however, again, does not show up on the x-ray. Therefore, the joint space in a normal joint is actually visible. In the knee joint, there is also the presence of the meniscus, which acts as an additional shock absorber for joint movement. In the second x-ray, bones are rubbing together as there is limited cartilage separating them. This leads to increased pain and decreased mobility. Sometimes the body can respond to the lack of cartilage by making additional bone. These bone deposits are called bone spurs and can be seen on the second x-ray. It is important to note that you are not your image. The structural changes you see on your joint x-ray do not correspond well to the symptoms you experience. In some cases, the structural changes may be severe, but associated with very little pain. So here are some myths and misconceptions regarding osteoarthritis. Knee OA is caused by wear and tear. True or false? Physiotherapy, exercise, and physical activity will increase knee pain. True or false? Exercise has similar sized pain relieving effects as analgesics. True or false? Exercise and loading the joint will cause further damage. True or false?
I'm Dr. Ross Demko, one of the orthopedic surgeons at Kelowna General Hospital and one of the members of the Kelowna Orthopedic Group. Many of you will be having a total hip arthroplasty. In general, this procedure involves the removal of the damaged and arthritic surfaces from both sides of the hip joint. A titanium stem is placed within the femoral canal and a titanium shell placed within the pelvis. Your body will heal to these implants and incorporate them to your anatomy. Generally, a ceramic ball is placed on the stem and a highly cross-linked polyethylene plastic liner placed within the shell. These combine to create a less painful and more functional hip for you. There are many ways to access the hip to achieve these goals, and each has its pros and cons. No matter which approach your surgeon chooses to use for you, all are likely to result in excellent improvement in pain, functional capacity, and as a result, quality of life. Total knee arthroplasty has two major goals. One is obviously to reduce the pain and as a result the functional capacity of the knee. The other is to correct the alignment of the lower extremity. Many of you will notice an increase in the degree of bowing, which is known as varus alignment, or an increase in the knock-kneed appearance of your knee, which is known as valgus alignment. This is achieved by accessing the knee through an incision at the front, which will create numbness on the outer surface of the knee. This is entirely normal and should improve with time post-surgery. The arthritic surfaces are removed from the ends of the femur and top of the tibia, and only enough bone to allow for implant placement, range of motion restoration, and alignment correction will be removed. The ends of the bones are then capped with metal components, which are most commonly secured through the use of a bone cement. A highly cross-linked polyethylene plastic surface will be secured to the metal component on the tibia. This is what interacts with the metal component on the femur and will give your knee a better function. Your kneecap or patella may or may not be resurfaced depending on your particular surgeon's assessment and personal techniques.
Hi, my name's Mary. I'm one of the clinical dietitians at Interior Health, and today I'm here to talk to you about what you can do to make your procedure the most successful in regards to nutrition. One of the things we know is weight management can play a big role in how you recover from your surgery. So I will be talking about that, and an interesting point here is the extra pressure on your joint, and it's quite surprising how much that is. So that's one topic I'd like to talk about, but really I also want to talk about nutrition and hydration and why that's so important going into surgery. We know that if you're well nourished going into surgery, your recovery is much better. You are healing quicker, and also it helps your immune system. Key nutrients for surgery, I've got a list here: protein, calcium and vitamin D, iron, and fiber and fluids. All important components of your diet to help with your recovery from your surgery. First off, let's look at protein. Protein foods are important because they help with your muscle building and healing before and after surgery. I've got a list of protein foods here for you. I just want to highlight a couple of them, and right at the top of the list you'll see beans and lentils. Commonly, most people aren't eating many non-animal proteins, so I like to highlight that. I also like to highlight the importance of having some protein with each meal and each snack. We know that particularly as you get older, your body absorbs the protein a little more poorly. So including some throughout the day, rather than just having a big indulgence of protein with your supper meal, will help your body to absorb more protein. Calcium and vitamin D, very important. They support bone health and help to reduce the risk of a fracture or fall, and also reduce the risk of future cancers. Iron is very important. It decreases the risk of you requiring a blood transfusion after your surgery or even during your surgery, and it helps you with your healing. Iron foods are found in red meats. You'll see that third down on the list. We know that the iron that's in animal products is best absorbed, But that doesn't mean that's the only way to get your iron. Beans and lentils, as I mentioned, a good plant-based protein food, are great sources of iron as well, as are fortified cereals. You'll notice when you look at some labels that most of the mainstream cereals are now fortified with iron. If you're on for example, a gluten-free diet, you'll want to check your cereals and your breads and see that you're finding something that's got some iron fortification in it. We do get some iron from plant foods as well. Spinach and broccoli are highlighted here. Next, we'll talk about fiber and hydration. So fiber, the reason we focus on fiber helps us for a lot of reasons, helps our digestion, helps our bowels, helps our cardiovascular system, so very important. It also helps fill us up. It's one of those foods that can help fill us up, and if we have a goal of trying to lose some weight, fiber can help with that as well, because of that feeling of fullness you'll get. Hydration, if you're going to start adding some fiber to your diet, you need to make sure that you're drinking well. And of course, being well hydrated helps the whole body work better. There's a list there of some high fiber food choices. So I said that I was going to talk about trying to lose weight. One of the really important things I hope I stressed at the beginning of my presentation here is the importance of going into your surgery well nourished. And well nourished means having proteins and vitamins and minerals in adequate amounts for your body size. When you're trying to lose weight, there's a lot of very restrictive diets out there that can cause tremendously quick weight loss, but unfortunately that's usually almost always at the detriment of nutrition. What we're recommending is slow, steady weight loss, maybe 1 pound or 2 a week. Even that, it sounds very modest, but even that is difficult to achieve. Being overweight does make the surgery more difficult and recovery more difficult. So it's something to be thinking about 6 months before your surgery, not 6 days before your surgery. Remember, we want you going into your surgery well nourished. So getting started with weight loss, there's some tips here. We talked about the balanced meal. I showed you a picture of the Canada's Food Guide. If you're interested to go on Health Canada and have a look at the Canada Food Guide, there's a lot more information that can help with meal planning, recipe ideas, snack suggestions, etc.
Why is exercise important? Well, we know what gives a hip joint or knee joint its stability and support are the muscles and soft tissue that surround that joint. The less we move, the weaker those muscles become, and we know that those weaker muscles can then create more stress on your joint. A lack of exercise can actually increase your joint pain and stiffness. The way that the body naturally lubricates the hip and knee joint is to produce synovial fluid. It does that through movement. The less we move, the stiffer the joint becomes. Exercise can also help you to combat fatigue and give you more energy to get through your day, as well as improve your balance and enhance your overall quality of life. Here are some tips to help you manage your joint pain. Make sure that you keep the impact low. Start with things like stationary bikes, elliptical trainers, or water exercises to help minimize the amount of stress going through your joint. Applying heat before you begin your exercise can help to relax any tense or stiff muscles and make them more pliable to stretch. Moving gently, beginning with range of motion or stretching exercises before moving on to strengthening or aerobic type exercises. Going slowly. If you have pain that lasts for more than 2 hours after you exercise, you've done too much. Do less the next time you exercise. Don't stop completely. Applying ice afterwards for 10 to 15 minutes, especially if the joint is hot or swollen, can also help to minimize your pain. As far as frequency and type of exercise, you want to incorporate stretching or range of motion or flexibility type exercises, strengthening exercises, as well as aerobic or endurance type exercise. Stretching can be done several times throughout the day. When you're doing a stretch, you're going to hold it between 20 and 30 seconds. This will help to increase the length and elasticity of your muscles. Strengthening exercises can be done using body weight, gravity, tubing, or small hand weights. You're aiming for 8 repetitions and gradually increasing to be able to do 15 to 30 repetitions of the exercise 1 to 2 times a day. You're going to aim to do your strengthening exercises 2 to 3 sessions per week. When it comes to endurance or aerobic exercise, you want to aim to be active at least 3 to 4 days out of the week. Your exercise should be at a moderate intensity. You're aiming for 30 to 60 minutes a day. You can do this all at once or break it up into smaller sessions of at least 10 minutes each time. Pick activities that you enjoy and add variety. Next, we will show you a series of exercises starting with a glute bridge. To perform this exercise, you do not need to get on the floor. You can do this in your own bed. Lying on your back with your arms at your side, bend your knees and lift your hips off the bed, squeezing your bum muscles. Hold for 3 to 5 seconds and slowly lower. To progress this exercise, cross your arms over your chest, or lift one leg. Your core is highly involved in all of the activities you do, including basic movements such as repositioning in bed, walking, and maintaining your balance. To strengthen your core, start with basic activation. Place your hands just inside your pelvic bone. Tuck your belly button towards your spine. Feel the muscles tightening under your fingertips. Progress this by slowly lifting one leg and then the other in an alternating fashion. Remember to maintain your breathing while keeping your core turned on. Your quadricep muscles are responsible for keeping your legs stable while you walk. Some of you may be feeling a sense of buckling while you walk. Strengthening this group will help to stabilize your knee. Start by placing a rolled up blanket or towel under your knee. Pointing your toes up towards the ceiling, lift your heel off the bed, squeezing the muscles on the front of your thigh. Hold for 3 to 5 seconds and slowly lower. To progress this exercise, sit in a chair or at the edge of your bed. Pointing your toes up towards the ceiling, extend your knee, holding for 3 to 5 seconds. Feel free to add an ankle weight for added resistance. A chair push-up will help to strengthen the tricep muscles on the back of your arms to prepare to use a walker or crutches after surgery. Sitting in a chair, push up using your arms, keeping your feet planted on the floor. Hold this position for 3 to 5 seconds, then slowly lower back into the chair. To progress this exercise, lift one foot and repeat. This next exercise focuses on strengthening the large muscles in your lower extremities. Sitting in a chair with your feet firmly planted on the floor, bend forward at the waist, using the armrest to push yourself into a standing position. Slowly lower back into the chair using the armrest for support. To progress this exercise, cross your arms across your chest, lean forward at the waist, and rise up into a standing position. This exercise focuses on strengthening your calf muscles. Standing in front of a chair, rise up onto your toes, lifting your heels off the floor. Hold for 3 to 5 seconds, then slowly lower back down. To progress this exercise, lift one leg, rise up onto your toes, hold for 3 to 5 seconds, slowly lowering back down. Balance not only helps to strengthen your muscles, but helps to reduce your risk of falls. Standing with a chair in front of you, engage your core, shift your weight to your stronger side, and lift the weaker side, holding 3 to 5 seconds or as long as you are able. Lower your leg and then repeat on the other side. To progress this exercise, hover your hands and repeat. Your heart is also an important muscle to exercise. We do this through cardiovascular or aerobic activities. Consider low-impact activities such as a stationary bike, pool or water aerobics, and/or an elliptical trainer. Remember to start slowly, breaking up your activity as needed. These exercises are designed as a starting point. There are many local resources available, including community programs. Please refer to your My Responsibilities handout for further references. What if it hurts too much? Let's take a look at understanding the pain cycle. When it hurts to move, it may seem like a good idea to stop moving to protect our joints. The less we move our joints, the stiffer and more painful they become, and the muscles that protect and surround them become weaker, thus making us more prone to injury. It's important to understand that hurt doesn't always equal harm. Once you can understand your pain and what kinds of movements are beneficial, you need to start moving in order to reverse this vicious circle. Research shows that doing this will increase your sense of control and make you feel stronger, which in turn can make you feel less afraid of moving, allowing you to increase your endurance and the amount of intensity of your physical activity. That in turn can make you feel more confident, more able to return to your normal activities, and thus reduce your pain.
Now that you understand the pain cycle, I want to talk about some pain management strategies. Common question is ice versus heat. Ice will reduce inflammation, pain, and swelling, applying for 10 to 15 minutes, usually after an activity. Some examples include gel packs, frozen vegetables, or a bag of ice cubes. Heat will decrease stiffness, relax tense muscles, usually most helpful before an activity. Apply heat for 15 to 20 minutes, and some examples include hot packs, warm bath or shower, or a heating pad. It's important not to put heat on an inflamed or swollen joint. That's what the ice is for. You may find an aid will help you. The use of a cane or a walker reduces the forces through the joint by approximately 30 to 40%. Holding it in the opposite side to the weaker or most painful leg is the most helpful. The height of the hand grip should be level with your wrist bones, arms relaxed at your side. Other equipment around the home that you may find helpful would be a raised toilet seat, bath stool or bench, tub rail, grab bars, long-handled reacher, and shoehorn, or a sock aid. There are other options for pain management strategies, including visualization, distraction, massage, and meditation. Visualization is redirecting your attention to a positive memory or sensation which may trigger the release of endorphins, your body's natural pain relievers. Massage therapist uses techniques to work on muscle and other soft tissues to help your muscles relax and improve blood flow, which can aid in healing. Meditation will help to bring clarity and tranquility to the mind and body to achieve full body awareness, which actually can lower your pain cycle.
Hi, my name's Kim. I'm a family nurse practitioner. I work with the orthopedic team. Today we're going to talk to you about pain management strategies. I know there's been many discussions about what you can and can't take prior to surgery. So primarily we talk about over-the-counter medications, NSAIDs, so non-steroidal anti-inflammatories, and acetaminophen, which is what we know as Tylenol. Those are certainly something you can discuss with your family NP or GP or community provider in terms of what you can take. The biggest take-home message in terms of pain medications is a good, decent trial of these medications pre-surgically. So taking these medications regularly, consistently for 2 to 3 weeks. In terms of herbals, something you have to have a discussion with your family provider with. And narcotics is something we consider as last line. These are very few and far patients, and it makes it very difficult for pain control post-operatively, meaning after surgery. So those are something we don't consider as first or second line pain management strategies. When we talk about smoking and surgery, we certainly always try to quit or decrease the amount of smoking in any substance, whether it be tobacco or other substances before surgery. And the reason why we emphasize this is because it decreases your risk of complications. It certainly, we know the literature says it reduces your risk or it reduces risks on many facets, but certainly in terms of wound healing, your range of motion, and your ability to heal faster after the surgery. So in terms of alcohol intake, we know that the Canadian guidelines do have guidelines for a reason, and this is specific for anyone, but more so we emphasize on alcohol intake pre-surgically. So again, similar to smoke intake, alcohol does have a risk associated with poor wound healing. We know that there's an increase in infection, blood clots, heart attacks, all the things that we do not want happening pre-surgically and more so post-operatively. So these are guidelines for women and men, and we certainly want us to follow this as best as we can. In terms of alcohol intake and how much we intake prior to surgery, we certainly do this because we want to avoid withdrawal symptoms. An increased age population certainly has post-op delirium as one of the side effects from reducing alcohol too quickly prior to surgery. We know that it can thin your blood for those that are on blood thinners and who have an already increased alcohol intake. And then again, we talked about risk of infection. So again, this is something that I recommend you discuss with your community provider in terms of how you do that if your intake is greater than the guidelines recommended on the previous slide.
Planning ahead. So some of the things that you can be doing now to make this surgery most successful for you are looking at making sure that you get in to see your dentist and make sure that all of your dental work is up to date. Patients should be in optimal oral health prior to their joint replacement surgery. Cleanings and fillings should be completed at least 2 weeks prior to your surgical date, and any other major dental work, including root canals, extractions, reconstructive work, must be completed at least 6 weeks prior to surgery. Any obvious decay or signs of infection prior to surgery may result in your surgical date being postponed. As this is still considered an elective procedure, we do ask that you have a solid discharge plan in place. Our average length of stay in hospital is between 0 and 2 days, which means some of you may go home as early as under 12 hours. You are required to have a buddy or support person at home to help support you post-operatively and help to drive you to your ongoing appointments with both your surgeon and your physical therapy team. There are no publicly funded rehab beds for this type of surgery. Now please turn to your My Responsibilities worksheet. Take a moment to fill out line number 10 in reference to your buddy arranged to pick you up after your hospital stay. Further, please refer to line 12 to note your arrangements for help once you are home. Once you have completed this Class 1 education session, you will receive a phone screen by an RN from the Surgical Optimization Clinic. At this point, some of you may be referred to speak with our physio and/or family nurse practitioner. Once a surgical date becomes available, you will be contacted by the surgical booking office and referred to our Class 2 education session. At this time, you will also be required to consult with a physio and RN from the Surgical Optimization Clinic. The physio will provide you with an equipment form for the Red Cross loan cupboard, and you will be required to pick up all of the necessary equipment 1 week prior to your surgery. After Class 2 requirements are complete, you will have a consultation with an anesthetist. Once all of these requirements are fulfilled, you will then proceed to surgery.
Please ensure you submit your completed responsibilities worksheet at or before your Class 2 session. If you have any further questions, please write them down to discuss with the RN during your phone screen. It is important to notify the Surgical Optimization Clinic if you develop an infection, have an open or weeping rash or wound, or a cold or a flu.
Thanks for attending our Class 1 Early Preparation for Surgery. We wish you all the best moving forward.